Namaste. After this video, you will be able to distinguish between antrochoanal and ethmoidal polyps. A 14-year-old boy comes with unilateral nasal obstruction. When you examine him, you find a single polyp which arises from the lateral wall of the nose. Now, is this an antrochoanal polyp or an ethmoidal polyp? It is an antrochoanal polyp. In antrochoanal polyp, the polyp arises from the maxillary antrum. It enters the middle meatus, spreads into the nasal cavity, and goes backwards to the cornea. Further, when it grows, it can also be seen posteriorly behind the soft palate, hanging behind the uvula in the oropharynx. So the antrochoanal polyp spreads posteriorly. It is usually unilateral and is seen in children, whereas in ethmoidal polyps, you can see multiple polyps that are present bilaterally and more commonly in adults. So these are the ethmoidal polyps. Let's look at it through a chart. So we have discussed that antrochoanal polyps are most commonly seen in children, and ethmoidal polyps are more commonly seen in adults. Etiology for antrochoanal polyp is infection, whereas ethmoidal polyps are associated with either allergy or they are multifactorial. Antrochoanal polyps are usually unilateral, single in number, whereas ethmoidal polyps are usually multiple. Laterality, this is unilateral and this is bilateral. Origin, we have seen in the diagram that antrochoanal polyps arise from the maxillary antrum. So these arise from the maxillary sinus near the ostium. Ethmoidal polyps can arise from ethmoidal sinuses, uncinate process, the middle turbinate, and the middle meatus. Looking at the growth, again from the diagram we have seen that antrochoanal polyp grows posteriorly. It grows backwards to the cornea and then hangs down behind the soft palate. And looking at the ethmoidal polyp, the growth is mostly anterior and it may present at the nares. Looking at the size, the ethmoidal polyps are small, whereas antrochoanal polyps are relatively larger. Antrochoanal polyps are also trilobed. They have three parts. As from the name you can make out antral, conal, that makes it an antrochoanal polyp, and nasal. Also, the ethmoidal polyps are small, they appear grape-like as a bunch. The antrochoanal polyps rarely recur when they are removed completely, and when they recur, we can use Caldwell-Luck operation. Next is ethmoidal polyp. Ethmoidal polyp have a common recurrence because they are associated with allergy and sinusitis-like conditions, which recur. Next is treatment. The treatment for both of them is polypectomy. We do FES here. We do endoscopic removal or Caldwell-Luck if recurrent. And in ethmoidal polyps, polypectomy. FES again, endoscopic surgery or ethmoidectomy may be done here. Ethmoidectomy is done intranasally, extranasally, or transantral. Antrochoanal polyp is also known as Killian's polyp. And you can always remember the difference by using a case to remember them. That antrochoanal polyp is seen in a child which presents with unilateral nasal obstruction, and in ethmoidal polyps, you can remember that it is an adult with nasal obstruction associated with either allergy or sinusitis. Thank you and please subscribe for more such videos.